Hello, class. Now we're going further with the health of the infants. Now, improving infants' health. One thing that it all goes to the health of the mother. How healthy is the mother? Health habits, healthy lifestyle. Those are all things that can improve the health of the infant. That could prevent premature birth when the child is not up to matured enough to be delivered. And most of the time, when the child is not matured enough to be delivered, it costs so much because you have to use some artificial equipment to help do those things that the child should be able to do by themselves naturally. And most of the time, a child might really encounter some developmental issues as they continue to grow if they even survive it. So again, healthy habits, frequent visits to the doctor, and so that you avoid things like premature birth, low birth weight, so that the doctors can see your obstetrician can see whether the child is really developing according to, because the weight of the child is expected to be at least at the point of delivery should be 5.5 pounds. If it's less than that, then there'll be some problem. The further away it's away from that, the riskier the probability of that child not making it. So low birth weight, pregnant mothers should make sure that they eat right. At times, some people make the joke they eat for two, or depending on how many babies are in the womb. It's a joke, but at times it. I think the key thing is eat. Try to eat healthy food, vegetables, grains, protein, so that you are able to making sure that you the mother is healthy enough, and the growing baby is also healthy enough, so that when the baby is born they are healthy enough. Smoking. You don't smoke before you become pregnant, you don't smoke during pregnancy, and you don't smoke after pregnancy, after delivery. Bad idea. Stay away from cigarettes. There is nothing good about smoking other than that facade that you get, that phony high. Smoking is not good for your health. The science is there. It's not only good for your health as the mother down the road, but if you smoke during pregnancy, the probability of having a low birth weight also increases. So please share some of this information to friends, especially those that are planning to become pregnant. If they want to have healthy babies, cigarette is one of those things that they should really take out of their regular routine, smoking. Now, alcohol and other drugs. At times, you have some kids who are born with the alcohol syndrome, fetal alcohol syndrome. Again, before pregnancy, stop drinking in excess. During pregnancy, stop drinking. And after the child is born, stay away from it because it's just a drunken mother is not usually a good mother. So it's better to stay away from all these other drugs that are around. Then you have also breastfeeding. It's very, very important. Even though now there are a lot of formulas and a lot of things that helps mothers take the place of breastfeeding, but at the end of the day, there's nothing better than the natural. See, these are all artificial ways of really taking care of infants. The natural way is the mother gives birth, the mother breastfeed the kids for some time so that the kid, the infant gets their immunity from their mother. They still continue to feed from their mother. They feed from her when they were in vitro, and they feed from her when they are delivered. And you make sure that whatever is being fed to this kid, to the infant, is healthy. Then you have the sudden infant death syndrome, SID. This is also something that kills kids. And some, depending on how they I think there are still some discussions as to what is really the real cause. But one of the things that a healthy kid and a mother who really knows how to take care of their kid, how to put them in bed, how to watch them on a regular basis, most of the time can prevent some of this sudden death. And a kid whose lungs are fully properly developed. Because most of the time, especially with smoking and all this other stuff, create some problem for the developing child. Their lungs are not properly developed, and it's easy for them not to be able to get enough oxygen, and they can just die. You have child health. Good health during childhood is essential to child's optimal development. You see, in fact, I would like to push it even further. A child who is healthy in vitro has a higher chance of also being healthy when delivered. That infant is delivered. And when that infant is given the right conditions, right nutrition, lives in the right environment, right food, a lot of care, that child, that infant can grow to be a healthy child. And when that child grows to be a healthy child, most of the time can grow to be a young adult. And a young adult will grow to be an adult and can be able to learn to develop effectively all the necessary skills that they need to develop to be effective or to be productive. So it's extremely important. All of these stages from conception to adulthood, they are all extremely important to be. Each stage should be as healthy as it can be to make the other stage much more effective. Because when any of those stages are compromised, it makes it difficult for the child to grow up to be a healthy adult. Medical home recommended. See, whenever there are challenges, some of those things can be recommended. Most severe measures of health in children, when medical home are recommended, most of the time there are most severe measures of health in children. When children may be low birth weight or have other health related conditions, they can be recommended to places for service wherein they can be held. Rates have generally declined in the past few decades. So because now people know some of the root cause of some of those childhood health related issues. See, once those now the rates more or less have started, because the mortality rate, especially when you think of certain groups, some of this, just like with a lot of statistical data or vital statistics, it comes down to the socioeconomic status as the driving force of the poor health outcomes, and at times also the race. Because now studies have also shown that there are certain mothers who are educated up to their PhDs, in fact, some even medical doctors, whose child succumb to mortality, die. So it's extremely important for all those issues, the health, the emotional, the caring, quality care, wherein the more the mother or the caregiver spends time with the doctor to understand, the better they can come up with ways to helping to reduce this childhood mortality rate, especially among minorities. Again, unintentional injuries are leading cause of death in children, starting from the crib. Every now and then you hear the recalls of certain cribs. Create an environment wherein the kid is secured, safe environment. A mother who is drunk cannot do much of a good job in taking care of an infant. And make sure kids have appropriate seat belts. In the car, the seat belt should be appropriate. Right feet Not just because, oh, you think that, no, it should be really right fit so that the child fits into it, so that in case of any accident, the child is restrained in a way wherein it won't cause more injuries. And also keep away the way you keep your environment. Kids like to put things in their mouth, cleaning stuff, all those things that are poisonous. Keep them out of the reach of children. Keep them away from the fire, from the stove. And those with the opportunity of having pools, please make sure that there are fences to keep the kid from drowning. You see, because these are all things you think, oh, well, if I have all those things, this should be great for my kid, will like it. Yeah. But when they get into the pool by themselves and cannot swim, it doesn't take long for that child to drown. So these are things that you have to really, really, really be careful. Keep them from in the stove. Keep them from certain things because now today we have so many cleaning stuff in our houses. Keep those things away from them. Keep them from medicines because kids like to take things and drink, or they put into their mouth. Certain things, putting those things into their mouth can kill them. It's a beauty to have a child, but it's even much more beautiful when you do all those things to see that child grow in a healthy young boy or young girl by taking all the necessary precautions. Especially, again, child mortality, as I said, most of the time in motor vehicle death, when the kids are not properly restrained, no proper seat belt. The seat belt laws have really saved so many lives. But you have to wear the seat belts properly, not just having the seat belt, but it should be. At times, even there are in certain situations, the size and the age of the child should be appropriate because some kids don't grow according to their age. So just thinking about the age alone, that is not enough. You have to think of the size, the age. And if you want to have them want to start you and driving and cycling, make sure they have helmet on. Start with the tricycle. They should wear a helmet. See, because again, the body of the child is still developing. The child falls and hits her head or his head on the pavement. That is enough to cause some big damage into the brain, and that could lead to death. Then come back to unintentional injuries, significant economics, poverty. See, nobody really wants to see their child die, but there are certain times when you cannot even afford the basics. that can lead to some issues, frustrations, and at times that can even lead to child abuse, emotional abuse, and can be disabling, it can have a disabling impact. So you have situations wherein it's not that, okay, the parent really wants to, but just because of some of those other constraints, poverty, cannot afford, cannot pay, they do not have the means, can lead to emotional distress that in some cases can lead to abuse. Then you have child maltreatment. Now, when those things are observed, they should be referred to the community to help the child. Because if not, that child can die. And also, most of the time, parents should also, especially those with some significant economic disparity, economic hardship, should seek help either through various philanthropic communities or organizations or through their respective churches. You see, most of the time it's one of those, if when poverty is the situation that one has to deal with, most of the time is there are times wherein we have to swallow our pride and ask for help. Because one thing that I've noticed in this country is people are good. But most of the time, for them to show that goodness, there has to be a disaster or somebody has to ask. And if you have to ask, so be it, so that you can see your child grow rather than see your child die because of lack of infectious diseases. Most of the time, there are a lot of infectious diseases that are now, if you look at the text, from 0 to age 1, certain immunizations the child should have, 2 to from 1 to 2, certain immunizations. See, because all of these things help. When the child is properly immunized, the child has a better chance of developing healthy. But if they are not properly immunized, possibility for them to be infected, and when they are infected, their immune system is not strong enough to fight the infection, they can die because of the infection. And especially in developing countries, it's a shame for a child to die from an infectious disease when all the way with it is here. Now, community programs for women, infants, and children. Now, the federal government has 35 programs. Now, some of these programs there to help the mother, the child, and those programs are run by the government. See, the community programs for mothers, for women, infants, and children, they call it the weeks. These are federally run programs, over 35 of them in 16 different agencies to serve the needs of the nation's children. Many are categorical programs only available to people who fit into a specific group, but many fall through the cracks. See, most of the time, it's not that, okay, some of these things, the possibilities are not there to help. But times some people don't know where to go seek this help. And or some people don't have the means to seek those help. So all of these things are things that everything being normal could be handled in a much easier way if the health of the mother is healthy and they have the appropriate information. I'm using the word appropriate information as to where they should go for this treatment, who will be there to give them this treatment or these services, and how should they use these services. I say because most of the time it's the intention is great, but most of the time the messaging is kind of a bit more confusing. So you get the resources, you get the right people to develop the message, you get the right messengers to deal with the intervention, and you do these follow-ups. You see, it might sound a bit too much, but it will cost the nation far more when we keep losing mothers, we keep losing children, or children that are not fully developed. They become burdened or appear to be more expensive as they grow up with disabilities or challenges. So it's one of those you invest early so that you end up reaping the benefit. Because when you have healthy mothers, you are likely to have healthy children. And when you have healthy children, you are likely to have productive citizens, engaged citizens. So there's a lot of dialogue, going on between some people who would want to make sure that people get all the assistance that they could get. And you have some people who are saying, oh, well, people should help themselves take by their bootstrap or whatnot. But again, this country is blessed enough. This country is not stranded because of resources. America is stranded because of lack of willpower, lack of commitment to see each other in ourselves. Not only our kind of small nuclear family, but to see each other as member of a big family. Because yes, this country is blessed. And at times, some people take advantage of the situation. But that should not lead those who really want to take full advantage of the situation to enhance themselves be deprived. So this is Title 5. It's only federal legislation dedicated to promoting and improving health of mothers and children. Okay. Maternal and Child Health Bureau. This was established in 1990 to administer Title 5 funding. Accomplishes goals through 4 core public health services. We're dealing with infrastructure building, population base, enabling, and direct health care. Help mothers, infants, children, week program. This is clinic program based, designed to provide nutritional and health related goods and services to pregnant, postpartum, breastfeeding women, infants up to 1 year of age, and children under 5 years of age. So this is extremely important. The WIC program has been around for quite some time. Help mothers during pregnancies, making sure that they eat right. They are healthy because, again, as I said, the child feeds from the mother. If the mother eats healthy, the child will be healthy. If the mother is starving, that child is starving. If the mother is eating poor food, poor nutrition, same thing goes to the child. So poor health give birth to a child with a poor health. So they even continue post-mortem after delivery. Help with breastfeeding. Because when the mother is well fed, properly fed, they have good, can produce milk, enough milk for the child to feed. Up to age 1, and in fact, up to under 5 years of age. These are very, very governmental programs. People should know where they exist in their communities. Where should they go to get these services? The government provides these services, and people should take advantage of these offerings so that pregnant mothers can eat right, can be healthy, so that they can give birth to a healthy child, and up to age 1, but up to age 5, can be assisted by the government. Because again, as I said, after delivery, breastfeeding is very, very important. I say at times with because of the advancement, or people tend to ignore those biology, basic biology. There is nothing that can take the place of a good, healthy mother's milk. Yeah, formulas can be developed here and there, but the best thing, especially those early months, child needs to be fed from their mother, or fed with their mother's milk. And yes, society should not frown on women pregnant and breastfeeding mothers who want to breastfeed their kids in public, because that's the role of the mother. Should not shame the mother because they want to do the right thing. Because a child who is properly breastfed has the possibility of fending, fighting against infections, because their immune system develops much stronger and can develop various organs, various body structures will develop continuously in a healthy way. So you also have, sponsored by the USA. See, the week program is sponsored by the USDA, established in 1974. See, the week program was developed by the government, the United States Department of Agriculture. It's under the Department of Agriculture. One of the things that the Department of Agriculture takes care of, in addition to so many other things that they undertake. How can you be your eligibility requirement? Residency in application state. You should be a resident in the state in which you live. Income requirement. You should fall below certain requirements. Your income should be less than, for you to be granted that opportunity to take part in that program. And you are at nutritional risk. Till up to 2014, over 9 million have participated in that program. Now, providing health insurance for women, infants, and children. Children without insurance more likely to have necessary care delayed, or receive no care for health problems. Children without insurance more likely to have necessary care delayed or receive no care for health problems. See, everything, again, you go to hospital first in what's your insurance? See, but here again, government has intervened with the Medicaid. Medicaid is a low-income individuals and families. Children are slightly more than half of all Medicaid beneficiaries. So you have the Medicaid, which is a government form of insurance for low-income individuals and families. Children are slightly more than half of all Medicaid beneficiaries. Then you have the CHIP program. Target uninsured children whose families don't qualify for Medicaid. Now you have the FMLA, which is providing child care, Family and Medical Leave Act. This grants 12 weeks of unpaid job protected leave to men or women after childbirth, adoption, or illness in immediate family. Only affected businesses within 50 plus employees can ask for it. So again, even though it's there, but how many other people whose businesses are less than 10 people? 40 people, 49 people, employees. See, at times, even though we tend to do things to help the poor, to help our children, but most of the time we really don't do enough to really expect healthy outcomes. At times, even with some of these government programs, they play around the surface and appears in the books as if something is being done, but in reality, it's not much because other kids fall through the cracks and they don't benefit or don't meet the requirements for some of these programs. And that's why at times it comes to some of these issues when people are talking about issues dealing with abortion. Some people are saying the cost of childcare is too costly. Well, can we put a price tag on a child? Or can we collectively help to making sure that that child has all that that child needs to grow to be a healthy human being. There are certain child care and development block grants that are provided. You have other advocates for children. You have numerous groups advocate for children's health and welfare. You have the Children's Defense Fund, United Nations Children's Funds, and American Academy of Pediatrics. These are all various funds, organizations that helps to improve the health of our children. Again, these are some questions. What are ways community program can increase participation in early prenatal care services? What kind of impact do programs such as WIC have on community health outcomes? So these are all very, very important discussion topics. But one of the things is start early to educate the mother about things to do and things not to do very early. Don't wait until they are pregnant. So because again, as I said, it's easy for us to think of pregnancy as as accidental, but in most cases it shouldn't be. We should do all that is needed. Mothers should stop smoking, drinking, eating fatty food, watch their weight, exercise, watch their stressors, and yes, boyfriend, husband should also play their part to making sure that the infant that is going to be part of or say the conceived pregnancy should be maintained in a healthy way through love. And at times, it's not only most of the time staff. Most of the time, yeah, people provide staff, but staff does not provide the emotional needs of the pregnant mother. Most of the time, it's just caring, it's just love. And what kind of impact do programs such as WIC? Again, you educate the mother during pregnancy, even before pregnancy, about the availability of WIC, the WIC program, where they can go for it. How can they qualify for it? And how can they access it? And those people providing the service, how easy is it for them, for participants to take part in it? How welcoming are they? Because at the end of the day, a healthy child comes from a healthy mother. And a healthy mother needs to be taken care of so that she can take care of the child. And that child can grow to be a healthy, contributing member of society. Okay.